Well, during the pandemic, we've heard a lot about how folks with underlying health conditions can be at a higher risk of becoming dangerously ill. But what does that mean for folks who have pre-existing conditions? In tonight's local original, for many, it means to not stop taking your medication. There are a number of factors that can increase your risk of COVID-19, making you very sick. That includes age, weight, and overall health. But what if you have an underlying condition that you keep under control, like high blood pressure or diabetes?
If they take something like valsartan or anything like that to lower their blood pressure and it's maintained, are they still at a higher risk?
Things like blood pressure, if you do a good job of keeping on top of where your pressure is at, diabetes, I would say, is the same. If you do a good job of keeping your blood sugar under control, this ought not pose you any greater problem than anyone else.
Dr. Cameron Wolfe is part of Duke University's coronavirus task force. He says the same applies to people with HIV who have a normal T-cell or white blood cell count and undetectable.
I've seen no signal to suggest that those individuals are at higher risk. Now, they'll be at the same risk as their age equivalent HIV negative compatriots. If you control your chronic illnesses, whatever they are, and you and your physician are happy about the way that they're maintained, I would suspect your risk is pretty much the same as the general population.
But that is not the case with all underlying conditions like heart and lung disease, including COPD.
There are some conditions that you can maintain them, but your level of function is poor. So, for example, folks with bad emphysema or COPD, they may contain their symptoms, they may not have as many flares as they once did, but their underlying lung reserve is still not as strong as it was when they were younger. Those folk need to be careful.
Careful and vigilant, and always reach out to your personal physician who knows your health history before assuming anything. And we can't emphasize that enough. There's a lot out there all over social media about risk. So you and your doctor are the ones who will know best, especially talk to your doctor. And again, don't stop taking your medication if you have medication to take. Now, you can read more on this story and all of my local original stories on the CBS 17 News app.